are dealing with the supraventricular tachycardia. So, supraventricular tachycardia, and let's look at some conditions. So, the first is we are going to see the supraventricular tachycardia with a narrow QRS complex. So, with a narrow QRS complex with regular, another condition is there is a regular RR interval. So, in such cases, first we will be looking at some tachycardias, that is a sinus tachycardia. So, here the ECG finding is that there is a normal P wave and there is a normal ECG features, and there is an exception, that is that the rate. So, except the rate, they have a normal ECG features. Next, we look at the focal atrial tachycardia. So, in terms of the focal atrial tachycardia, so the ECG features is that there is a single type of abnormal P wave. So, single type of, there is abnormal P wave. Abnormal P wave morphology is seen. Next, we will look at the junctional tachycardia. So, junctional tachycardia. So, in terms of junctional tachycardia, there is no P wave. There is no P wave, and then the heart rate is 100 to 200 per minute. Next, when you look at the AV nodal re-entry. AV nodal re-entry tachycardia. So, in this case, there is no P wave. There is no P wave. There is the pseudo. There is a pseudo R wave. Pseudo R wave. This may be seen, and the heart rate is closing 150 to 250 per minute. Then we will look at the atrioventricular re-entry. Atrioventricular re-entry tachycardia. So, in this case, there is a P wave, and it always follows. It follows the QRS, and there is the RP interval. This is less than the PR interval. Then we are looking at the atrial flutter. So, in terms of the atrial flutter, there is a sawtooth shaped. There is a sawtooth shaped flutter waves. The sawtooth shaped flutter waves are seen. Then we are going to another subheading, that is the narrow QRS. So, we are looking at a narrow QRS, and this is with a irregular. There is a irregular RR interval. So, what is the tachycardias? We are seeing the atrial fibrillation. So, under atrial fibrillation, there is a no distinct P wave. There is no distinct P wave. We are seen. Next, when you look at the multifocal atrial tachycardia. The multifocal atrial tachycardia. So, here there are more than 3 abnormal P waves. There are greater than 3 abnormal P wave morphologies are seen. Then we are moving on to the atrial flutter. There is something known as the atrial flutter, and there is tachycardia, and with the variable block. With a variable block. So what are the ECG features? So there are ECG features of heart block are seen. Then we move on to another category, that is a supraventricular tachycardia. So this is with a wide QRS complex. So under this, it includes the antidromic AVRT. That is nothing but the atrioventricular re-entry. Atrioventricular re-entry tachycardia. Next, there is a supraventricular tachycardia. So this is with the bundle branch block. So this was all about the supraventricular tachycardias with some variations. And to learn and grow daily, please do subscribe.